I did the same surgery that ChatGPT recommended. I used ChatGPT to assess this picture and asked it to evaluate the treatment. This is the AO classification for subaxial spine injury. Type A is compression, type B is tension band injury, type C is translation injury, and type F is facet injury, which this is F3. C6 bladder mass fracture, and I wanted to describe it. It's a floating bladder mass. ChatGPT thought this is a hangman's fracture and provided details on that. I told it, this fracture is at C6, please provide AO classification. It thought this was a type C fracture and again provided details on type C injury, including bilateral pedicle fractures, but that is not true because it's a unilateral pedicle fracture. I told it this is type F3 fracture and I asked for appropriate management. It said you're correct, and it provided management including non-operative and operative treatment, which included posterior, anterior, and combined. It asked for an MRI, so I provided with an MRI. MRI again shows C6-7 disc bulge, as well as interspinous ligamentous injury. ChatGPT thought there was cord compression and spinal cord edema and traumatic spinal cord injury, which is not true. Options were posterior, anterior, or both. I asked for SLIC score, and it provided a good job. It did a good job. It said rotation or facet fracture, which is 4 points, disrupted facets, 2 points. And this patient was neurologically intact. It's supposed to be 0, but ChatGPT thought there was some neurologic issue, so it gave it 2 points. Greater than 5 is surgical intervention, which is true because this patient had a score of 6, 4 plus 2. I asked it what surgery would suggest, and it provided posterior and anterior options. I talked to my partners. 2 partners suggested posterior approach, 1 partner suggested anterior approach. Its final choice was posterior, which is cool because which is what the highest number of partners suggested. I did the surgery, C5 ladder mass, C6 and 7 pedicle screws, and LAMI. I asked for its comments and said it thought it was ladder mass screws only. And it asked about local autograft BMP. It seems to think that it's a well-executed posterior